My name is Jennifer Stoner, and I'm a nurse practitioner student at St. Joseph's College Online, and I'm here today with my preceptor who's filming and my volunteer patient for Unit 4 doing a neurological exam and an abdominal exam. So we're going to get going. I'm going to wash my hands here. Start by testing your vision here. I'm going to have you hold this vision chart up and cover one eye and read the lowest line that you can see.
574019.
Okay, that's 20/40 on the left, and then we'll do the same thing on the right eye.
57401913.
Okay, 20/40 on the right. Thank you. I'm going to test your peripheral vision here next.
Okay.
I'm going to put my hands behind you and move them forward, and just tell me when you can see them.
Yes.
Yes? And then tell me if you can see my fingers move.
That's it.
That's it?
That's it.
Okay.
Both it.
Okay, good. I'm going to do it again. Tell me when you can see my hands.
Yes.
Okay, can you see my fingers move?
That's it. That's it. That's it. That's it. Both. That's it.
Okay. And we'll do that one more time lower. Tell me when you can see my hands.
Yes.
Okay.
Both.
Both sides.
That's it.
Okay.
That's it.
Okay. Good. Next we're going to take a look at your eyes here. I have a light I'm going to shine in your eyes. Just going to look at your pupils. And I'm checking her pupils. They're about a 2+, equal, brisk, reactive to light, and accommodation. Okay. That looks good. I'm going to have you open your mouth. Okay. And clench your jaw down. Good. Do that one more time. And one. Okay, good. All right. And then I have you raise your eyebrows up and down. Okay, good. I'm checking for symmetry here. And I want you to smile and frown. Okay, and blow out your cheeks. Puff them out. There you go, good. And then pucker your lips. Okay, good. Let's see here. Next we're going to check your uvula and soft palate for symmetry with phonation. So I'm going to have you stick your mouth and say, ah. Okay, and I'm also going to check your gag reflex. Okay, good. All right, and then I want you to also stick your tongue out again. Okay, and just stick it out. There you go. So tongue is symmetrical with no fasciculations. And then I want you to move it from side to side, like this. Okay, that's intact. One other thing I forgot to do with your eyes, I want you just to follow my light here. Okay, good. Okay, her extraocular motion's intact, and her eyes are conjugate. Next, let's test your hearing. We're going to do a whisper test, and I'm going to have you cover up one of your ears, and I'm going to whisper on this side, and you just let me know what you hear me say.
40. 22.
Okay, good. Do the same thing on this side.
21. 88.
Okay, good. And we're going to do a Renee test now. I'm going to put this tuning fork up to you, and I want you to just let me know when you feel the vibration stop, or you can't hear it anymore.
No.
Okay, can you hear it?
Yes.
Okay, we're going to do the same thing on this side. Can you tell me when that stops? The ringing.
No.
Okay, can you hear it?
Yes.
Okay, good. And we're going to do a Weber's test. And just let me know if you can hear that bilaterally on both sides equally.
Both sides, yes.
Okay, good. Next I'm going to have you shrug your shoulders. Up, up, tight. There you go. Good. And do that again one more time. Okay, good. Maybe you close your eyes. I'm going to check your sensation on your face here. I'm going to use light touch and just let me know if you can feel that.
Yes, I can feel. Yes.
Is it equal on both sides?
Yes.
Okay.
Yes. Yes. Same on both sides.
Same?
Yes.
Okay. And on your chin?
Yes.
Is it the same?
Same.
And your nose?
Yes.
You can feel that?
Mm-hmm.
Keep your eyes closed. I'm going to keep going down. Just test your
Yeah.
arms.
Yeah, that's same.
Equal?
Mm-hmm. Yeah.
Where do you feel that?
Yeah.
Okay. And then we'll do your lower extremities.
Yep. Yep.
Equal?
Equal.
And
Yeah.
you can feel that?
Mm-hmm.
And does that feel equal?
Yes.
Okay. I'm going to have you keep your eyes closed. I'm going to give you a familiar object that I want you to identify. You put in your hand here.
Okay.
A pen, good. And then we're going to also write a familiar object on your skin. I'm going to use a letter.
Okay.
So you just let me know if you can recognize this letter.
T.
Okay, good. I'm going to do another one.
O.
Okay, one more.
T.
Okay, very good. I'm going to have you put your hands out here. And I want you to touch your each of your fingers to your thumb. Okay, that's intact. And then I would also like you to do a flip-flop here. I'm checking for cerebellar coordination. And that looks good. And use your other hand and do the same thing. Great. And then I want you to take one of your fingers and point it out and touch your nose. Good. And then touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Good. And then do with your other hand. Touch your nose. Touch my finger. Touch your nose. My finger. Your nose. My finger. Okay, good. Let's check your reflexes next. Get my hammer here. First we're going to do her tricep. Deep tendon reflex. Okay, that looks good. And I'm going to have you just lay back here. I'm going to feel her bicep. Okay, good. And we're going to do the radial. Okay, good. And we'll go down to the side. We'll do the patellar next. Good. And the Achilles. Okay, good. And the Babinski. Okay, good. We're going to go and do the same thing on this side. We'll just get your arm here. Checking the bicep, tricep. Okay, good. Okay, good. And here's the radial. So that was the bicep, and then this is the radial here. Okay, good. I'm going to do the patellar. Okay, good. And then we're going to do your Achilles here. Oops. Okay, and then we'll do a Babinski on this side. Okay, good. All right. Next I'm going to have you get up and stand up here. Let me get this chair out for you. Step stool, and then I'm going to assess her Romberg. So what I'm going to have you do now is just get your feet together, have your hands at your side, and I'm just assessing her stance here. And she looks steady, and she's not swaying or toppling. Can you close your eyes? And now I'm checking to just make sure that she continues her stance for 1 minute, 30 seconds to a minute. And I don't see any swaying or any toppling or side preference, so that's negative. I'm going to have you come over here, and I'm going to have you just walk across the room. I'm going to assess gait, which looks steady and equal, and walk back. Good. And then I'll have you do heel to toe, put one foot in front of the other across the room there. Oh, it's smooth and accurate. She's not wobbly or anything. Can you hop on your right foot? Okay, good, and your left foot. Okay. And then I'm going to have you sit back up on the table here. And I'm going to lay you back down. We're going to do your abdominal exam. Just going to lift up here, down here. Okay, move this. And right now I'm just assessing her abdomen. I'm looking for any abnormalities, any masses, any lesions, any scars, which I see none. No masses, no lesions. I do see striae, no concerning moles. Her color is consistent with her ethnicity, and her temperature is warm. And I don't see any abnormal contours. Symmetrical abdomen without any bulging masses, hernias, or that sort. So the first thing we're going to do here is listen to your arteries for bruit. And we're going to first listen to the aorta. And moving over to the left renal artery. And no bruits. Right renal artery. And then we'll do the right iliac artery. And the left iliac artery. And left femoral. And right femoral. Okay. No bruits heard. I'm next going to listen to her bowel sounds in all 4 quadrants. Okay, bowel sounds are present and active in all 4 quadrants. Next I'm going to percuss her abdomen. Checking for dullness, tympany, or flatness. Okay, and next I'm going to palpate her abdomen for any tenderness or masses with light palpation and then deep. Having any tenderness or pain?
No.
Okay. Okay, and then I'm going to attempt to palpate her liver and her spleen. And her spleen and liver appear to be normal findings, no enlargement. Okay, great. I'm going to have you sit up here. And next we're going to do the costovertebral angle. And we're going to percuss for the CVA tenderness. I'm going to kind of locate her last rib here, the 11th or 12th rib, and then percuss between the angle of that and the last rib here. Any pain, tenderness?
No.
Okay. All right. That completes our exam, I believe. Anything else I need or any input at this point?
I think you did great. I don't remember if you did the face clenching for one of the nerves.
The jaw clench?
The jaw, she
I
did?
clenched.
I missed it, but you did really
Did I
good
at the
job.
beginning?
Yep.
Okay.
I think you did great. All right.
Okay.
Bye.
Great. Thanks, guys.